Miss Robin.
Hey, Greg.
Hey, how are you?
Well, I'm good, except I'm good. We're rocking the human design thing. That's just great.
Yeah.
But this morning, mid-morning, I just suddenly got this grab in my right cheek, butt, and I've got this sciatic. I've got some kind of thing that I can barely walk and barely sit. I'm just in excruciating pain on my right side, in my sacrum, butt cheek. Just there's this big grab or something. Not sure what happened.
Is it radiating down the leg or is it just in the butt cheek itself?
Not going down the leg, no.
Okay. And sharp pain or like a toothache or
It's it's both. It's just right now it's a dull ache, but if I go to stand or walk or move my body, hits a sharp place.
when you're sitting in a chair, is it hard to like find the spot that's comfortable? Do you feel
Yes,
like you keep fidgeting? Yeah.
yes.
So that is a piriformis issue. Like anytime like you're sitting in a chair and you're just like, I can't get comfortable, like you keep trying to find that perfect spot. That's the piriformis, which is this big muscle that, well, it's not big, but it's a muscle that kind of goes across the middle of the butt cheek, but it passes over the sciatic nerve. And when it tightens, it pushes up against the sciatic nerve and pushes the sciatic nerve up against a bone in the pelvis, because the sciatic nerve is passing through a hole in the pelvis right there. And so when it tightens, it pushes up against the sciatic nerve and then pushes the nerve up against the bone. And so it's actually referred to as piriformis syndrome. And so like it sounds like if you're not sitting, it sounds like it's achy, but it's not like debilitating. So like anytime you have something like this, you don't want to poke on it too much because it's already like that nerve is already irritated. And so like massaging on it or sitting on a tennis ball will actually like aggravate it more. And so you want to reduce any sort of irritation. So you can put a little ice on it just to reduce some of the inflammation, but you want to look at oils that are like marjoram or the pain relief neuropathic or peppermint, something with like mint in it, like spearmint, peppermint, corn mint, anything like that you can put in a little bit of lotion and rub on it will have an antispasmodic effect and a pain relieving effect. And you just basically kind of have to keep unwinding that spasm and the pain for just a little bit. Like sometimes it can be quite chronic, but if you just had it happen, you just got to unwind it for a little bit and usually will be fine. And so if it's not feeling too much better, like within a couple of weeks, I would say, we'll keep treating it, but like in a couple of weeks, if it still feels like it's a little bit of an issue, the sciatic nerve is one of the few nerves in the body that has immune cells on it. And after like 2 to 3 weeks, you actually will start to have an aggravation in the allergic response. And so I would say if it's still there in a couple of weeks, we need to start doing things to calm down the allergic response so that you don't get allergies on top of it and make it worse. Treating allergies doesn't make it better, but you're wanting to undo the effects of the sciatic issue on the immune system. And so this is probably something that you can knock out kind of quickly, but do something antispasmodic like marjoram, basil, petitgrain, vetiver, spikenard, any of those, like rub it on the spot, do it multiple times in a day. And for just pain relief, anything with mint or the pain relief neuropathic, birch complex would actually even work as well. Wintergreen is another choice for antispasmodic as well. And like monitor that if it starts going down the leg or down the front of your shin, or you're starting to feel it in your foot, it means it's progressed a little bit. And you just got to keep unwinding it. But I would, like when you're sitting and doing things, I would get up and move around more often than normal. Like even if you can do some of your typing, even like laying down with your legs straight might even be a little bit better for a day or two. But it's kind of hard to write like when you're doing that. So sitting at the chair, maybe every 30, 45 minutes, just get up and move around a little bit, just so that's not always in that one position and starting to cramp.
Okay,
Yeah.
great. I'll give it a shot.
Yeah. Yeah. Is that the first time that's ever happened to you?
Yeah, like this. I've had sciatica before, but I haven't had this where just like,
Yeah.
oh my gosh, I can't. It's just like
Yeah.
that right side has just grabbed.
Yeah.
And
The piriformis it's a weird thing. Like it can get irritated, which with like little to no like stimuli. Like, it could just be like normal wear and tear. But like one of the things that you would do as like a therapist is you would evaluate like how people's feet, like the more that they rotate out or rotate in, it's usually more outward. Starts to tell you like what is happening with some of the rotators in the hips. And so there starts to be sometimes a potential like imbalance, and it starts to rotate the leg a little bit, and then that actually can throw the piriformis off. But if you haven't really had this problem before, it's what I would consider like more of an acute kind of condition. And so a lot of times if you just treat it like as spasms and things like that, a lot of times it'll just unwind.
okay,
Yeah.
great.
But don't sit on something to, because like that's like on any other part of your body, you go, oh, I have tension or tightness, and like you do a little compression with like a tennis ball or those foam rollers.
Yeah.
It can be helpful. On this, it actually will make it worse. And so
Okay.
it's one of those ones where all those other things, you throw those out for a piriformis issue. And you can do like usually ice makes it feel a little bit better. I mean, it doesn't resolve it, but it just can calm things down a little bit. But a lot of times just antispasmodics and then resting it or letting the leg be straight for periods of time. And then are you a side sleeper, a back sleeper, a stomach sleeper?
Side.
Side. Um, when you're sleeping, do you spend more time on the side that's bothering you, like down, or is it that side up?
I kind of rotate back and forth.
Probably try not to lay on that side very much. And the reason being there's this there's a name for this syndrome and I can't remember what it's called, but it's basically there's a ligament that goes between the pelvis and the head of the femur. And sometimes, I mean, you can play with it. It might be that when it's up in the air or down on the bed, like pay attention, like, does it ache a little bit more in any of those positions? Because what happens is like sometimes the leg, like it goes too far down and it starts to stretch this ligament, and then it actually will throw the piriformis in a spasm. And so in extreme cases, the person would sometimes have to lay on their back. But a lot of times if it's when it's up, if you just prop up with a pillow, or sometimes it's when it's in the bed, and be it that the bed is soft or who knows. Like if it's that way when it's a little bit more aggravating or achy when it's that side down, then just avoid that for just like a few days. Like it's not forever. It's just, it's that ligament is slow to like repair. And it's not that it's torn or irritated. It's just like how you would get tendonitis. You can get like a version of that, but in a ligament. And when you do that, it stops holding like ligaments are bone to bone, and they keep you from overextending the joint, right? And so they really don't do any of the muscle movement. They just limit the range of motion so you don't hurt yourself. Like this joint only moves so far, like it only does these motions, right? And so it's a way of protecting that joint. And so when they get irritated, sometimes what happens is you're able to go a little bit past what is normal because the inflammation makes that ligament lose tone. And so then all of a sudden you're going past that point, and now it's starting to irritate some of those muscles. So it could be that even that's in play, but even that with just a little bit of rest usually goes away.
Okay.
Yeah, there's nothing big to do other than just some anti-inflammatories, rest, a little bit of ice, and it usually will go away.
Terrific. Thank
Yeah.
you.
But if it doesn't, like within a couple of days, if you're not finding relief, like let me know. Like,
Okay.
I think we are talking on Thursday, so let me know by Thursday.
All right. Thank you, Greg.
Yeah.